Welcome back, everyone. CHI Health St. Elizabeth's Regional Burn and Wound Center is seeing record frostbite cases this week due to those frigid temperatures we've seen across the state throughout the last several weeks. And here with us now to talk about it is Eric Jensen, a burn and nurse and a community educator with some critical tips to stay safe. Eric, thank you for joining us today.
Thanks for having us.
So what's the update? You were just telling me you guys have seen an even more uptick since we reported some more last week.
Absolutely. We've had about 20 admissions since the weekend into our unit. That's probably close to about a month and a half worth of admission in just a few days that we normally see. So quite a few. We've had about 40 new outpatient appointments, which is also a pretty significant uptake just related to the cold weather injuries.
And how are some of the, what are some of these patients who've been exposed to the elements, and is it any common factors that you've seen so far?
Sure, we see a lot of different things. Some are just work related, being out in the conditions and not taking those precautions, getting out of the weather, dressing appropriately, taking that time to rewarm, especially when they recognize some of those first signs of frostbite. Some of them are the elderly, falls, things that are unavoidable sometimes, or at least maybe even avoidable, but just taking that extra precaution and making sure somebody knows that you're outside if you're a little elderly and take those extra precautions.
Yeah, it's only going to get colder this weekend
too.
And why is frostbite treated as a burn? Why are you guys specifically see this?
Sure, it's a wound to the tissue, and so we treat the tissue, and so anything related to the tissue is kind of our specialty. We still classify them very similar to a burn injury, first, second, third degree kind of classifications. So a lot of the same treatments for the burn injuries we can do for those patients with frostbite injuries as well.
And what are some of the signs, like if you are working outside, or you have to, something's unavoidable, you have to be outside, what are some of the signs you can look out for to maybe go inside and warm up a little bit?
Sure. The first kind of symptoms are going to be that tingling fingers in your hands, nose, any of those exposed places, your ears, your nose. Those are the first places you're going to feel those signs. Once you kind of move past the tingling and you start to feel that numbness coming on, or you're like, oh, it feels a little bit better, it's probably moving into those later signs where you're starting to have some of those more deep frostbite injuries starting to occur.
Will you see it on your, will you be able to see it, like physically see it? Or?
Right away you'll probably just see some redness.
Okay.
It might change to a waxy kind of white looking appearance. Once you kind of warm up, you may start to see some blisters form, kind of like you'd see with even a sunburn, those kind of type blisterings, or even a scald injury, you'll get the blisters. You might see some of those blisters start to form once the thawing starts to occur in those areas. So you might not see the blisterings outside,
right.
Might just be that redness outside in the weather, but once you warm up, you'll start to have that, and then the increase in pain will be pretty significant, so you'll want to start to seek some medical attention at that point.
And there's some things people can do at home to kind of keep people safe and maybe treat them a little bit?
Sure. First thing is just keeping yourself safe from the elements. Yeah. So dressing appropriately, covering up all those exposed areas, whether it's the nose, the ears, keeping those hands nice and warm. If you do get something wet, so you're moving snow, you're doing something where you get some of those clothing articles wet, you're going to want to remove those and then redress, and then keep yourself warm. If you do develop a frostbite injury, you're going to want to protect that injury. That tissue becomes almost like tissue paper, so it's really, really fragile. So you don't want to become rubbing it very much. That'll cause more problems. So just really protecting that tissue is the first thing you're going to do, and then seek appropriate medical care, whether it's primary care physician or moving towards the burn center for definitive care.
Yeah, scary time eventually, So thank you so much, Eric, for telling us some of those tips, and hopefully you guys get a little less busy here.
Sure.
On that third shift.
Thanks for having us.
You bet. All right, Jessica, and things are just going to get a little bit more colder and snowier today.